I'm delighted to announce that WHO has the honor of working with Kim Sledge of the legendary group Sister Sledge and Natasha Mudhar, founder of the World We Want organization. Together, we're ready today announcing the start of a new
to transmit in, and you could be prepared for that. And I think one of the things we need to emphasize as much as we possibly can, the importance of the isolation of cases and quarantining of contacts. And you hear us say this over and over again, but it might be worth mentioning that quarantining of contacts means that individuals ideally could be quarantined outside of their home, but we know that that's not possible all over the world. Quarantining at home for 14 days. That means not going to work. It means not going to the grocery store. It means not socializing with friends. It means not having people over at your home. And people who are in quarantine need to be supported through that. Because of course they still need to make a living, they still need to provide food for their families. So it's really important that those who are in quarantine, those who are isolated as cases and those who are in quarantine are supported through that period. This will break chains of transmission. And without isolation of cases, without quarantining of contacts, it will be incredibly impossible to do. So really, I think we just need to emphasize what that means. And I've had a lot of questions over the last few days from family and friends about what quarantine actually means. And I think it's just worth emphasizing what we mean there. But I wanted to just highlight that there is no inevitable second wave or next peak. It's within our control, it's within our hands as individuals, but also with strong government leadership, clear national plans, implemented with targeted controlled measures at local levels, we can prevent additional subsequent waves of this happening.
Thank you. I would like now to invite Gabriela Sotomayor from Proceso to ask the next question. Gabriela, can you hear me?
Yes. Hola, Fadela. Thank you for giving me the question. I have a question regarding Europe and the cases that we are seeing in Europe and the numbers. What was done wrong? What happened, especially to prevent a dramatic scenario that we saw in March from happening again? For example, in China, there are 5,000 deaths. And in Europe, we have 250,000. In the United States, it's 200,000, sorry. So the contrast in numbers is impressive. So does it have to do with the treatment they are giving in patients in China or in Asia? I mean, what can we avoid? How can we avoid to be in a dramatic scenario again?
I think that's an interesting